Thank you. Home care's role is going to be changing as healthcare changes. The next big shift, which we are already in terms of healthcare reform, is the movement from reimbursement or payment to organizations and individuals on the basis of the volume of work that they do to a value-based reimbursement system. Again, I think this is going to be both a relief and an opportunity for home care, because if you're able to measure outcomes that are superior to the outcomes that are achieved in a hospital environment or in an environment where there's less teamwork with a group of practicing physicians, you will have a difference in the outcome in terms of the economic support of your organization. I think what I envision is an era of recognition on the part of physicians on the one hand and home care agencies on the other, and the professionals who populate those home care agencies, is that there's a collaboration that creates opportunity between the two of them. You know, when you're talking about putting organizations together, you always ask, what sort of value will this create? There's no point in one organization joining another if it doesn't create a new and vibrant opportunity. And that's just what's happened with the union between Atrius Health and VNA Care Network. Both organizations are stronger because of the collaboration. So as we go forward and as we explore the opportunities that are created in these collaborations in the context of healthcare reform, and actually driven to take chances because of the realization that we need to get ahead of the curve of healthcare reform, we're going to discover things that we haven't even thought about yet. At least that's my hope and expectation. In the future, there'll be an engineering of systems so that what was once a separate office practice or ambulatory practice of doctors and the nurses in their offices, and what was another separate world, which was the world of visiting nurses who were going into the home, that there will be a much smoother continuum connecting those two entities, so that the barriers that we now see in terms of the passage of information and the confusion that's associated with transitions for patients will be greatly ameliorated, and we'll have a continuum of care that benefits everyone in the transaction: the patient, the Visiting Nurse Association, and the practice of physicians and office-related nursing. I think because of the payment changes associated with the healthcare reform movement, there will be new opportunities for home care. At this moment in time, home care and the services that it can offer patients is actually inhibited by the reimbursement model. As we move more towards a model of reimbursement that's focused on reimbursing for value and not for volume, we'll see the opportunity for home care to really demonstrate what it can do to benefit patients and moving them towards better outcomes. You know, as we seek to bring better care to individuals and make the community a healthier place, but realizing that we need to be very careful with our stewardship and our resources, home care is an answer to many of the problems that we encounter. My goal, dream, is that we actually never admit anyone to the hospital who has an ambulatory sensitive diagnosis. By that I mean congestive heart failure, COPD, complications of diabetes. All of those entities, which constitute about half of the hospitalizations today, I believe can be cared for much more safely, much more comfortably in the home environment. And we're just at that moment in time where the intersection of our ability to conceptualize better care and the technology to support it are coming together. But ultimately, the core to make it all work is a committed group of professionals who are willing to take the chances and to be brave and to prove what they know in their hearts to be true. Prove in a way that the rest of the more skeptical world can accept it. So I think that that's where home care stands right now. It stands on a long tradition of service and respect, but looking out over the vista of a much greater opportunity an opportunity that is just in fact what the nation, the community, individuals need, but aren't quite ready to recognize. So I think there's a great future. There's going to be a moment of learning and acceptance on the part both of you and your ability to operate in a much more focused and collaborative way with the physicians of the community, but also a moment where we need to educate our patients both in a cooperative way between physicians and nurses as to what we can do for them together that's better than anything that they've ever had before. So my only regret is that being at end of career, I won't be there for the golden era. But for those of you who will be, you're very lucky, and you have my hopes and best wishes for the success that I know that you will be able to achieve. Good luck to you, and be well. Thank you.